When we start reading blood films, we begin to believe that all we need is the CBC and the slide to provide the care our patients need. But this is wrong and can potentially do harm. That is because it ignores everything else that is going on with a patient, both currently and historically. So to provide the best care, you need to understand the blood film and CBC results in the context of that patient. Context allows you to paint a picture that the care team can use to provide the patient with the best outcome possible. So what do I mean by context? Well, one dictionary definition is the set of circumstances or facts that surround a particular event or situation. In other words, what's going on with the patient? That may mean looking at the patient's history, their current medications, why they are visiting or getting this blood work done, and their current and historical blood results. So patient history. This can include seeing if they have any medical diseases or disorders such as leukemia, hemophilia, or sickle cell disease. Do they have a history of alcohol use or misuse? Do they have a substance use disorder such as opioid use or even a polysubstance use disorder? What medication were they on or currently taking? Are they on antibiotics or chemotherapy? What is their reason for this visit? Are they here for a follow-up blood work? Did they just have surgery and are post-operative, aka post-op? What about their blood work? Was the current CBC in comparison to the previous ones? What about the biochemistry or microbiology results? Have they had a recent transfusion? If so, of what product? I know you're saying, that's a lot of things to be looking at for every patient, every time. It is, and I'm not expecting to do such a thorough analysis for every patient. What I am saying though is at minimum, you should be looking at their diagnosis and their current and previous CBC, differential, and morphology results. And that during certain situations, it may benefit the patient for you to take a deeper look into their history. Such as seeing a sea of targets when you look down your microscope may make you look at their liver function tests, while also checking to see if they have liver disease or alcohol use. Or if you see toxic granulation, check to see if they have any microbiology results or if there are signs of inflammation in their biochemistry tests. Because the goal is to make sure the picture we are painting is correct. We don't want to say it's a boat in the ocean, when in reality, it is a camel in the desert. This means not forcing the narrative and letting the cells and the patient's history tell you their own stories. But in that vein, in emergency situations, the story may not match the historical evidence. If the patient is coding, that picture may be significantly different. Or if they are a trauma patient, there will be no history available, except that they are a trauma patient. You need to use the approach that the blood work and the slides are snapshots, not movies. Even if you have 4 blood samples over the course of a day, each one can be significantly different. The patient's blood work could be pre-op, operative, post-op, and post-transfusion. Same patient, but different contexts. So we need to make sure we are seeing and giving the whole picture. To help, we need to keep our skills at cell identification sharp. So check out this video here to continue you on your hematology journey. Thank you for watching. Until next time.